Welcome back. Singapore will continue to expand its preventive drug education efforts, such as through collaboration with schools. The Home Affairs Ministry says there is a concerning rise of young people abusing drugs. 156 youths below the age of 20 were arrested for drug abuse last year. That's up by nearly 20% from 2023. Sherlyn Seah with more.
A moment of silence to remember victims of drug abuse. Last May, Singapore held its first such Remembrance Day, with more than 100,000 people pledging to be drug-free. It will take place again this year on 16 May as part of the Home Affairs Ministry's continued efforts in preventive drug education, or PDE.
We will also continue collaborating with schools and parents. All schools will continue to conduct at least one PDE program annually. MOE will work with CMB to invite parent support group leaders to participate in capability building sessions on drug-related topics and will continue making PDE resources available for all parents on the Parents Gateway portal.
Last year, around 3,100 drug abusers were arrested in Singapore, in similar numbers to 2023. On top of prevention efforts, MHA has also laid out plans to rehabilitate drug abusers in helping them wean off their addiction and turn over a new leaf, of which is focusing on evidence-based rehabilitation. For instance, a supervision regime to help ex-abusers stay clean after leaving rehab. The Central Narcotics Bureau piloted it last January.
The preliminary findings from the pilot are positive. CMB was able to swiftly detect more supervisors who had relapsed via hair tests as compared to under the urine supervision regime due to the longer detection windows for hair tests. About 2/3 of the supervisors rated the scheme as very helpful in their reintegration. CMB will fully operationalize Supervision 2.0 in phases with the aim of placing all supervisors on this regime by 2026.
CNB will also refer them to the necessary agencies for support, such as help with housing or employment.
Singapore Prison Service is trialling a new model of family reintegration for inmates. It is meant to strengthen these relationships. Minister for State of Home Affairs for Faisal Ibrahim announced this during the Committee of Supply debate.
Inmates will also attend support group sessions led by community partners and peer supporters who had completed the program. This allows inmates to shift their identity away from being offenders to being role models.
A project that allows parents in prison to have video calls to keep up with their children's progress will also be expanded to more schools. Ex-offenders will also get more support from Yellow Ribbon Singapore to reach their career goals. Those in halfway houses will also get a longer period of aftercare support. Infrastructure upgrades will also be made to help those with mobility issues. Now, the prison service is trialling smart sensors in its medical wards and cells to remotely monitor inmates' vital signs, in a move that could transform healthcare management in prisons, particularly as the number of elderly prisoners increases. The system allows prison officers to respond more swiftly to incidents such as falls or abnormal heart rates. The proportion of in-care inmates aged 65 and above has doubled between 2020 and 2024, reaching 8% last year. And this shift highlights the need for innovative solutions to ensure the health and safety of an aging inmate population. 5 prison cells now have sensors on their walls and ceiling. If an inmate falls or has an abnormal heart rate, an alert will be sent to prison officers and medical professionals. The prison service will decide if the sensors will be rolled out more widely after the trial ends in April.